What's going on, everyone? Happy Thursday to everyone. Hopefully, everyone is doing well and staying safe. If you had to take a COVID test, hopefully you have tested negative today. It is now time for the Thursday evening edition of the Pandemic Update for Thursday, July 20th, 2023. India's active COVID cases today have risen to 1,476. That is an increase of 51, and the overall cases there had increased by 51, and unfortunately the death toll is now at 531,915. Moving on now to this, we are going to be talking about a few places where COVID cases are rising, and apparently Michigan is one of them. It says here, resurgence of COVID renews calls for health measures in Michigan. Health officials monitoring data in Michigan say that hundreds of cases of COVID continue to roll in while dozens of people die in a week from the illness. The resurgence may become part of the norm as time goes on and that the virus continues to mutate. It's something that didn't have to be normalized if they didn't stop people from wearing these darn things too soon. I know people are sick and tired of seeing masks. Trust me, I know. I saw the comments yesterday. Remember, if you follow me on Twitter, I did a grocery store mask picture yesterday, and I didn't look at all the comments. I saw some of them, and some of them were not so nice. Guess what? I hate to say it, and I'm not trying to sound mean or anything, but I think some people that just refuse to mask, that just, talk bad about it, unfortunately, it is only a matter of time until they get infected. I don't know why they don't want to protect themselves, because then they end up having to suffer the consequences. Moving on to this, speaking of cases rising, we're going to look at this, and then a little bit later we're going to take a look at wastewater, and I'm concerned with what's going on in the Northeast. Here's an example of that. Massachusetts has been especially bad, and Massachusetts is pretty good, or at least from what we have seen, because we've reported on several nursing home outbreaks in Massachusetts back in the spring, up through the summer, and, well, there's another one, Westford, Mass. The State Department of Public Health confirmed back on Tuesday what a source told Boston 25 News earlier this week, that a nursing home in Metro West is enduring a COVID outbreak. Department of Health says Westford House, located in Westford, saw its first COVID cases on June 29th of 2023. As of Monday, the Department of Health says 16 residents and 2 staff members have been infected by the virus, but there have been no COVID deaths. The facility houses about 120 beds, so we'll have to see. Hopefully this does not grow. And again, I'm concerned about the Northeast. You'll see when we get to wastewater. In Toronto, there is a COVID outbreak, another COVID outbreak in Canada at a hospital. A unit at a West and Toronto hospital has been forced to limit new patients after COVID-19 outbreak was declared, and I believe it was just yesterday or the day before we reported on a COVID outbreak in Canada in the cardiology department or something like that. Yeah, so it's not good. And taking a look at the website today, I don't have anything new to show you. I am going to possibly be working on the website a little bit later this weekend. I do have a link up here that you can use to get to this YouTube channel. You can always just go to datareport.info. I also have COVID wastewater up here. Added that recently by request, and I'm probably going to change this YouTube channel. I'm going to probably put the climate channel up there as well. So I am going to work on this later on. There's a few things I do need to add. Alright, let's take a look at air quality for today, and I have to refresh this. And you will see that there are some poor air qualities ongoing in the east. I mean, look at this. A couple bad numbers ongoing in Pennsylvania and down in Washington, D.C. Then we come out to the west coast, and that's where the worst air qualities are in the country. We do have this storm system that's going to be coming through the Northeast. It's actually going to be a very nice weekend in the Northeast, and air quality won't be half bad. I don't think we're going to have another wildfire episode until maybe later next week. So right now, it's not bad. Let's take a look at Walgreens for the week. The national positivity at Walgreens is 33.7%. The prior week was 32.5%, a difference of up 1.1%. Current week's testing was 1,753. Prior week was 1,426. Let's take a look at a couple states, shall we? Tennessee, 16% positivity. Prior week was 10.7%, a difference of 5.3% up. And total test 25 versus 28. Let's take a look at Indiana, where positivity is dropping 10.3% versus 13.2%. The prior week was 23.5%. This is a legitimate drop because testing is up. 29 tests versus 17. And let's see, did we get anything out of Delaware this week? No, we did not, but we did out of Maryland. What is going on there? 25% positivity this week, 36.8% last week, difference of down 11.8%, and one test more than last week, 20 versus 19. So, yes, this as well is a legitimate drop. And let's do one more. Let's go out west. Utah, 15.4% positivity this week, prior week 16.7%. That's a difference of down 1.3%. Total test, 13 versus 12 last week, so this is a legitimate drop. All right, now we have to take a look at wastewater. Yes, I know. It's not good. Yes, the West Coast is dropping. Yes, the Midwest has leveled off. The South continues to rise. The Northeast is now rapidly rising. So remember we talked about Boston? If there's one nursing home outbreak, there's likely more because look at this wastewater. 1 week, 2 weeks, 3 weeks, 4 weeks now. The Northeast has been rising, and it appears to me the Northeast rise is actually picking up the pace. It's actually rising more in the Northeast than it is down in the South. This is not good. And I think part of the problem is a lot of people have been stuck inside in the Northeast because of the weather being so stormy lately. And there's another system that's coming through the Northeast tonight into tomorrow. So, unfortunately, it's just not a good situation. It's going to get a little bit nicer over the weekend, so maybe that'll allow people to come outside. But next week it does get hot again, so I'm concerned. The Northeast is rising. It's going up rather quickly. You're going to see New York State in a few minutes. Concerned about that as well. Let's take a look at the other wastewater. I'm going to move myself to the left. And new sites, 164. 0 to 19% COVID detected, 556. 20 to 39%, 394. 40 to 59% detected. This one went up. That's at 160. 60 to 79% detected. That actually dropped a little bit. That's at 45. That's the orange sites. There is one more red site this week. That would be 80 to 100% detected. And that is now up to 5. I thought it would rise a little bit more because we did see a lot of sites that were rapidly rising, but it didn't. We're going to get another update on COVID variants tomorrow. Uncertain whether or not I will actually do a full variant video. And the reasoning for that is, if you look here, the data is so jumbled. So probably what we'll do with that, unless they fix this issue, probably what we'll do with this is we'll just incorporate it within the pandemic update tomorrow. We'll just add a couple extra minutes to the video. And, we'll run through some of the regions. I'll look through the regions beforehand, and I'll point out the ones that are most concerning to you and to me, the ones that have me concerned. All right, emergency department visits. It's still bad. We're still seeing areas of substantial rises. Texas, Maine, but we do have some that are stable at this time. There's quite a few of them that are stable. There's a couple that are dropping. Now, let's see here. We have, I think, roughly 1, 2, 3, 4, 5, 6, 7 that are dropping at this time. But again, the rest either did not report, are stable, or are rising. So, yes, we do have some areas of concern. The South is of concern. I would have expected to see the Northeast a little bit higher, and that's simply because we see what's happening with wastewater. Let's go back to that. We see what's happening with wastewater. It's rapidly rising in the Northeast. So you would normally think with wastewater rapidly rising there, that emergency department visits would be higher. We'll see what happens next week. I'm not wishing for them to be higher, but it looks to me as if at the moment there's a decoupling of hospitalizations in the Northeast from what's being seen in wastewater, which is a good thing. All right, taking a look at this. July 20th of 2021, this day in COVID history. The Lancet reports that more than 1.5 million children worldwide have lost their primary or secondary caregiver due to the COVID-19 pandemic. So that is this day in COVID history. Now let's take a look at these wastewater sites that can detect other things that are going on, and I have to refresh this because sometimes it always just goes blank on us. And let's take a look at a few of these sites. I say today, let's check and see what's going on. How about Montpelier, Vermont? COVID cases, they are rising at this time. We would expect it to rise there because they just got terribly displaced and out of whack from all that flooding. Maybe some people had to go to shelters, maybe they had to huddle close together, and, that's enough to cause a potential surge. And then we take a look here, influenza is not an issue. They did recently have some RSV issues. That has since ended. HMPV issues have ended. Monkeypox not being detected in Montpelier, Vermont. And norovirus is at low levels at this time, but it is being detected. 10,100 people at this wastewater shed. And let's do another site. Let's go somewhere else in the country. How about Arkansas? I can't say we've done Arkansas in a while. Harrison, Arkansas. 15,000 people at this watershed. Wastewater is slightly dropping. Influenza is not an issue. RSV is not an issue. HMPV is not an issue. And no monkeypox being detected. Norovirus does exist. It's leveled off and maybe it's slightly starting to rise again. So there is norovirus in that area. Let's take a look at what's going on with New Jersey for today. I have to refresh this because I know for a fact that is not up to date. Let's see, did it come in with New Jersey for today? And here we go. New Jersey has 173 people in the hospital. 68 out of 70 hospitals reported today. 7 people on a ventilator. And in the ICU, we currently have 14 people in the ICU in New Jersey. Discharges, 23 people were discharged from the hospital. So that's something that's good to see. Philadelphia added another 826 EMS incidents. Again, it's always concerning when it's over 800. We've been super hot, and I'm just already expecting between the rising COVID cases in the Northeast and how hot it's going to be next week. Check out my climate data report. The link's down below. It's going to be hot next week, up through about New York City and eventually even up to Boston. So a lot of heat-related illnesses, they're going to start rising in places like Philadelphia, Baltimore, Washington, New York City. A lot of the big cities on the East Coast are going to see that next week. Taking a look here at Montgomery County, which is just outside of Philadelphia. There's currently 13 incidents ongoing. But mind you, I am seeing here there are a couple accidents, but we also see cardiac arrest. Another cardiac arrest, respiratory emergency, so a few concerning ones that are mixed in as well. Don't get me wrong, accidents are bad within themselves, but cardiac arrest, that's one of the king of the crops. That's bad. Taking a look at New York State, you can see we have 498 people tested positive in the last 24 hours, not including people who took an at-home test or reinfections or people who've decided not to get tested because they think they have a summer cold, allergies, or something else. 7% positivity, that's still holding. That's higher than we would like to see it. 7-day average is 7.3%, and unfortunately, I have to show you hospitalizations. Yes, they're rising in New York State, so it does make sense there with wastewater and cases being higher, positivity being higher. It only makes sense that hospitalizations are starting to rise, and that includes the fact that maybe some people are not getting tested for COVID upon admission or hospital acquired or whatever the case may be. In New York City, it's the same there as well. Hospitalizations are starting to rise. You can see 3 days in a row with rising hospitalizations in New York City. And let's take a look at hospital admissions. You can see hospital admissions, they are starting to be on the rise, so that is concerning. So overall, not a great picture in New York right now. Please take extreme caution if you live in New York State. And as you can see, Texas this week did report rising cases, and hospitalizations are rising there as well. Deaths were down this week. There were only 19 deaths versus 23. 592 people are in the hospital in Texas at this time. Let's take a look at some international cases, shall we? And today on the international front, we are seeing that around the world cases are down 22%, weekly deaths are down 45%. Singapore cases are now up 99%, 8,544 versus 4,302. They did not report any deaths this week. As we come down here, we can see Canada It's saying 60% decrease in cases, but honestly, I think there's a huge undercount in cases ongoing in Canada right now. Bangladesh cases are up 2%. Deaths are at 2 versus 1 from their previous report. India cases are now up 51%. And deaths, however, are down 33%, 2 versus 3. But cases, yeah, we're watching India. It is starting to rise again. Afghanistan cases up 62%. Then we come down here to Switzerland, where there's a 12% increase in cases. And we come down to some more places that are rising. Iran, 53% increase in cases. Denmark, 2% increase in cases. Morocco, 43%. And yep, that about does it for today. That's all I have for today's pandemic update. Again, pay attention to tomorrow. We may have the variant update, we may not. It's uncertain. Depends on how they release the variant update this week. If it comes out all jumbled and not in any particular order, no, we're not going to do it. But if it comes out in order, by all means, we'll have a variant update. So pay attention. If we don't have one, it'll just be mixed in within the pandemic update for tomorrow. If you like this video, give it a thumbs up. If you want to see more content like this, subscribe to my channel down below. If you know of anyone who needs a reminder that the pandemic's still ongoing, or anyone that needs the latest information around the pandemic, or whoever, whatever, I don't care, just share it with them. We need more people to find out about this because we need to help prevent more infections. That's my goal. If I helped raise awareness about what the infections are doing in your community, then I'm doing my job. Keeping you guys safe is my goal. I will see you all again next time. Until I see you again next time, stay safe, everyone, and thanks for watching. Have a great evening.